Welcome once again to The Sage. Were you with us last week, the episode before this, as we started a dive, an exciting adventure, talking to two very, very enterprising and inspiring young people who have a passion for health education and who not only have a passion because of what they as health professionals had witnessed in the health facilities, but decided to move that passion a step further and actually do something about it. And so they started a health education outfit where they started producing. By the time we were discussing with them last week, they told us they were already producing videos and sometimes doing site visits. Let me remind you who our guests are. We have Dr. Alex Nnadozie and Ebere Nnadozie. Thank you for continuing to be with us on set.
Thank you very much. Thank you for having us again.
So unfortunately we had to stop, but let's continue. So you had told us about the videos, you had told us about some of the site visits. What more does your unit do? Are there any more?
Yeah, so in 2020, COVID struck the whole world, and our programs were of great assistance to some people in 2020 because we continued to bring out tips and help guides for people to try to calm people down. In fact, we did a video where we went around to healthcare professionals to talk just a few seconds to people, to calm people down, to tell them that we're here for them, that they should stay at home while we're here for them. There was a video like that that went around. And then we kept bringing, we talked about those who smoke, what COVID could do to them. You know, we talked about it just a few minutes. Then we talked about the elderly, COVID and the elderly. We talked
People
about
like us.
we talked about those with chronic diseases like diabetes and what have you. So we kept bringing these tips, you know, supporting people, and people were engaging, you know, with us. So COVID-19, we tried to use our platform, you know, to engage the people and try to bring the people.
So you have a platform, you have a YouTube channel?
Yes, we do.
Okay. We were displaying the name of your channel so that our guests can indeed benefit from the wealth of information that is already there within the channel.
Yes.
Please go on.
Yeah, thank you. So from then we decided to take it further. You know, apart from the Hausa show we did, we decided that a lot of people who may need all this information may not have the data to watch some of the social media platforms. So we decided to visit MDs of hospitals, especially the public hospitals where a lot of people come to, and people of low income classes. So we met some of the MDs to say, these are your TVs at the waiting areas in general outpatient department, in antenatal clinics, in pediatric waiting area, where patients and their families come, they sit down and they're watching this internet television or this cable television, they're watching drama and all those stuff, that we want to penetrate your televisions. We want to bring our shows to your televisions so that as they're sitting down, like one show we are working on, we call Ask Me 3. It's still going to come out. You know, it's about consultation. A patient is sitting down waiting for his turn, and he's taught the right way to articulate their point, to get the best out of the doctor, because the doctor is seeing 100 people. If you don't get the best out of that doctor, the doctor will just quickly give you prescription, and you are out without getting what you have come for. So we have a video we're working on that as the person is sitting down waiting for his turn, like, oh, okay. And at the end of the discussion with the doctor, he can ask the doctor those 3 questions. Please, doctor, what is my main problem? If the doctor wasn't thinking of his main problem, the doctor would be like, oh, exactly, what is his main problem? You know, and secondly, what do I need to do? So the doctor will discover that all what we have said, I actually need to package it well for this patient to understand.
And allow the patient to exercise their patient rights.
Yes.
Because many times they don't realize that it is a duty the medical professional owes them to explain clearly to them what is up. Too many times the professional has it in his head, writes you a prescription, sends you away next.
Yeah. Exactly.
A lot of our people, when you ask them, okay, you've been to the hospital, so what did the doctor say? I don't know. So what drugs were you giving? I don't even know. Let me get the bag. You know, so they're not aware of what the doctor thinks is happening to them, and they don't even know the names of the drugs and what they contain. So this is very important.
So we want to take our videos in the languages of all these people, either it is Hausa, Igbo, Yoruba, or Pidgin English, so that as they come for antenatal clinic in one health center in somewhere in Kazaure or anywhere in the country, they can sit down, one retired matron who is guiding them, or one community health worker who is guiding them can play this video of a top obstetrician from Lagos or Abuja or Enugu, teaching in a language they understand a few things about bleeding after delivery, or identifying an emergency when you are pregnant at home and what time to get to the hospital, the right food to eat when you are pregnant, teaching all these things, and they watch it and they discuss it. They have a wonderful antenatal that they don't have the privilege of, because they don't see the midwives that other people see that teach them, like you had in your own time, like you were telling us how the nurses will be teaching these things, It's difficult to find them now in rural communities in primary healthcare center, because the midwives will run away from there to the big cities or to other countries for greener pastures. So these things are lacking. So because this is the internet age, this is the media age, then we can as well, they don't have this obstetrician, then we carry the obstetrician to them through electronic media. So these are the steps we are engaging in now.
I think that's a profound statement. Carrying the information to them and using the technology that is now available, which would allow us to deal with the fact that tragically things have not improved, like I said, some of it laughingly, but that I practiced as a public health physician, a medical officer of health, some 30 odd years ago, 35 years ago, and yet many of those rural facilities are less equipped, have less support than in those my days. And that is tragic. But good-spirited citizens like you, both of you, I'm very impressed, can actually try and bridge that gap. Use technology to make that information accessible to them. And I think that's a profound statement, which is why I'm dwelling on it. I think that needs to be supported, and to ask you, what are your plans for expansion? What are your plans for dissemination? You've described this excellent one about at least getting it within hospitals. Yeah. But these hospitals are facilities made largely in still urban areas, right?
Yeah. For a start.
Do you have any more dreams, hopes, aspirations about how your information can be disseminated? When you say YouTube, it is still very much urban. The villager doesn't watch much in terms of YouTube, has no data. Any ideas? How can we disseminate?
Well, that's why we want to do the videos in the different languages of our country, in Hausa, Igbo, Yoruba, and if possible into more languages. So when this is done, we'll find a way of getting them to these rural areas where these languages are what they use in their communities, so that they can understand the teachings and know what to change so that they can improve their health. So I'll leave the technical bits of it.
Okay.
In addition to that, we stumbled on a document from the primary healthcare system of Belgium. And Belgium is practicing beautiful telemedicine for their primary healthcare system. So these primary healthcare in the rural communities don't have the big doctors in the urban areas, in the bigger centers. So they use this telemedicine system so that those people in the local communities, of course, this is a more advanced country where people have access to the phones and all that. So they consult doctors from the urban centers, and then there are ways of medications getting to them. The HIV patients don't have to gather in a clinic and queue up so that everybody will know who has HIV. Today is HIV clinic, they all gather to collect medications. No, they are on telemedicine. you know, and they have their drugs delivered to them, you know. So it has helped them. The local people get to see the bigger doctors, you know. Now, if there is need for a physical meeting, it will now be arranged. So we saw that document, and then we heard that the telemedicine of Nigeria is domiciled with the Space Center. So we had a meeting with one of the directors at the Space Center, and they actually showed us everything. There's a lot of infrastructure the country had acquired for telemedicine, including ship hospitals.
Don't let me, don't lose your thought.
Yes.
But I want you to explain to my audience what the telemedicine works on. Is it via telephone? What is this technology?
Yes.
You know, so when you say hear from a specialist, what is the medium of communication?
It's majorly audio or video, majorly, so that there are those that can speak to a consultant from far on phone, get a booking for a time, just the way a consultant sits at their consulting room to consult those who are physically present. So they book some of them on radio, phone for the person, and then they talk. And then some can be by video, so that the consultant is looking at the patient, you know, by video. So that there are patients who may not have all the gadgets, you know. So in their centers, in the primary healthcare centers, government can, or whoever, can put something so that they come for consultation. Only that some churches have been doing it for so many years. You know, the general overseer is in another state, and people gather for fellowship, and they put a video of their general overseer, and they are saying amen, you know, where they are. So the patient goes to a primary healthcare center, but instead of just seeing the chew, he sits down, and the provided screen, just one, but everybody can use it for different consultation. The person is seeing a consultant from somewhere, and then they discuss, and a prescription is given, you know. So it's working perfectly for them over there in Belgium. And instead of trying to look for all the workforce that can go to our primary healthcare centers in very rural communities, we can have a few, you know, maybe not so specialized. Then those few will be linking with the very specialized ones, so that they still get to see. So I will be happy in my specialty to sit down in my living room and consult 20 patients in a day. I did not step out, but my bank account is smiling. You know, it's much more money, but then bring it together, it becomes big money. So we are thinking in that line, so that when we take our devices to these communities, like we've said before, in the languages they understand, there should be a way they can also see these doctors and talk to them. They've watched the doctor talk to them, you know, through our videos. But what if they have a complaint? You know, that's where telemedicine comes in. So they can now tell the doctor, this thing you said, I have been feeling like this ever since. And the doctor may say, do this or do that, or I will arrange once a month, I will be in your center, you know, and the conversation can go on from there. But our challenge has been that doctors are very good with just, doctors and nurses, treating patients. And if you tell somebody, I have this dream, you know, we can take it to this level. We found it difficult to get people with that passion to want to join things. But there are doctors who are doing wonderfully well now. Of course, the popular Aproko doctor has just dedicated his life to use the media, you know, and there are a lot of people like that. And that is why I'm always grateful to my wife, who were both working in the hospital, but decided to step aside to make this dream come true. You know, me, I'm still there, you know, and maybe when I'm retired, I'll be very much available for her.
Long time to come. But let me push you a little further and say that for me too, this is not. It's something I give thought to as a physician myself, a public health physician, particularly because of COVID. Can we make telemedicine work in this country? The challenges are huge, because telemedicine is most important for areas that do not have access, okay?
Yeah.
Those rural areas. But many times they have no data, they have nothing.
Yeah.
They have no television, they have nothing.
Yeah, I mean,
So
that's
even
what-
when you're talking about consulting, you know, it's still very much an urban project.
Yeah.
Because, and then coupled with the fact that our medical staff are overwhelmed already. The doctors that exist, even though they're concentrated in the urban centers, their work schedule is crazy. I'm sure I described your life.
Of course.
So being able to telemedicine even for the doctor or the nurse, requires some time in your already overworked caseload. But no problem is ever too big to solve. Can I suggest, for instance, and I do hope some of our viewers and so on that are watching, that this is perhaps what one can target local governments and states for their support. They can make it happen.
Exactly.
They can undertake for every health center they have in their state, for instance, to provide a television and some basic equipment that allows, even if with time you don't achieve teleconsultation, at least the health education to be disseminated. So that, like you said, the videos, this thing you're aspiring for, hospitals and so on, every health center in a local government puts together, it doesn't require a lot of equipment, it doesn't require a lot of money, a television, so that every center has this, wonderful information available for the patients that come. So I don't know whether in telling me this you've addressed the plan for the future.
Yes, the plan for the future is presently to escalate the language programs we are doing. We started in, I think it was 2022, when we collaborated with the Association of Resident Doctors to produce a few jingles in different languages. And even though I said we've not found passionate people, that period, we found doctors who were happy to speak their languages, to speak to the people in Hausa, in Igbo, in Yoruba. And one Yoruba doctor did pidgin English, and I was shocked, So that video is still out there, and it was aired on World Health Day, as a matter of fact. So this is what we want to expand now, to teach people in their local languages, to move it all around Nigeria, so that in those local communities they are hearing something being said in their language. There was time in medical school we're wondering that why are we learning all these big jargons in the names of Italians and the Spanish people and what have you? Why are we not naming things in Hausa, Igbo, Yoruba? And I think the Yorubas have a way they are going into all that now, writing some medical text in their own language, So if you can teach our people, a patient came to the hospital, the child was malnourished and in the southeast, and they were asking the woman, why are you so beautiful and you're not feeding this baby so well? The woman said, you will not understand, this is Nta. And I did not know what Nta is. So, but if I bring a doctor who probably understands what they mean by Nta, to come and break it down for this woman, that this is not Nta, your baby is malnourished and you're not feeding this baby well. But she kept saying to her people that these people will not understand. Doctors don't know what Nta is. That is Nta that is wrong with my baby. And I couldn't help her so much because even me, I did not know what she meant by Nta. So this is our...
What is Nta? Tell us, because some of my guests don't know.
Now, so maybe you watch this and you help the sage to tell us what Nta is, because till this day I don't know what Nta is.
I think Nta, because I've heard it before too, I think it's something like there's something sucking when the baby eats, something takes it away. So it's more like failure to thrive, the way they look at it. But the point is, how much have you done to encourage this child to feed or to help this child with nutritious?
Again, I go back to, I purposely asked that because I also thought Nta was referring to a living something inside the child that is taking away nutrition. And worms do that. So our people in the communities are very aware of the fact that there are living organisms, particularly things like, they don't know it as tapeworm, for instance, but that actually as the child is eating, the worm is consuming a great deal of the nutrition. So some of it is local but backed by fact. It is, and there was a time, again, I don't know whether public health has changed a lot from when I was practicing in the community, where deworming was a regular part of the treatment because it's a fact. And that is where their belief about Nta comes from. Something natas. Nta is to eat. Something is eating what the child is eating. So sometimes let us not decry their wisdom. And a standard practice for our rural, we've talked about the high level of malnutrition amongst our children, as I gave the statistics in the previous episode. And a lot of it actually is due to the need to deworm helminths that are, helminth infestation and so on and so forth. So they have wisdom on their, yeah. But before I ask both of you to give your parting shot, your last few words to the audience, let me say that for us on the Sage, we are putting out a passionate plea. We're saying to the audience watching, remember that the purpose of this is not just because we want to talk, but because we want to improve the health of the people. And that if we can support an enterprise like yours, if people can come together, if, like I threw out there, local government, for instance, can take it on, and each local government in this country endeavor to equip its health, collaborate with a group of you who work on producing these great materials, so that the materials are regularly displayed in the health facilities, no matter how rural, because the local government provides them a television, a video player, perhaps a generator, so that it can be powered and played. We will make a tangible difference on the health of our people. And so that is the plea out there. I hope some people will reach out and want to partner with you, and that this project can grow. And of course, when I mention local government, but also all goodwill citizens, they will provide some funding, because funds are necessary for any good expansion. And so it's a wonderful idea. It's achievable. Health education is so important for our health that it's validated. I mean, I don't need to justify it to our watching audience. And so I turn to both of you and say a few parting shots. Let's start with you, Ebere.
Okay, I would like to encourage our audience to take advantage of health education, whether it's on social media or you go to a hospital and you hear people educating. You should take advantage of it so that you are prepared to help people or to help your own family or yourself during emergency situations.
Alex.
All right, thank you. I want to start my final words with thanking Conversations for Change for helping my wife with the with the knowledge to edit our own videos, and even with the equipment to get these videos happen, so we don't have to pay like we used to for our videos and putting it up there. So she edits now, so she's good.
Wow.
She's good at editing, and I have to thank C4C for that. And for the people out there, I want to say, imagine the figures that the host of this show presented in some episodes ago about maternal mortality and child mortality. Imagine if we send these materials, these videos, in languages that can be understood to all the communities around this country, one community at a time. Imagine what the figures will be. Imagine if they will still call us the maternal mortality capital of the world. So imagine a mother who would carry her baby for 9 months and then dies after having that baby. And then look at what would have happened if she doesn't die. You know how we love childbearing in this country, the joy that follows childbearing. But see what happens when that woman is taken away from the picture immediately after having that baby. But we can really do something about it. I'll end with saying what Norway did. Norwegian countries are the best in healthcare. I'm sure you know that. And what they did from the 1950s wasn't buying MRI machines. It wasn't doing big things, spending big money. It was simply quality improvement and health education, telling people the right thing, and they overtook every other country in the world in maternal mortality figures, in child mortality figures. Let's put hands together, to achieve this for our country and our people.
Couldn't have been better said. The sheer power of the right information, getting to the right people and to as many of our people as possible. And so I am so privileged and pleased that I have this young couple here with me. and they discussed this, how they brought to life this their passion and goodwill, willing to put their knowledge and their technical expertise into producing solid, great information that is potentially useful to millions of our people, women and children, but generally everybody too. Life-saving advice and techniques so that we can be useful to ourselves in times of emergency and in times of normal life. So thank you once again, Ebere and Alex.
Thank you.
It's been a beautiful example of the fact that we can all do something. We can all improve the life and the situation of our people, Nigeria. This is living our hope of becoming a more compassionate people, a people who care enough about ourselves that we do things like this so that lives can improve. I thank you very much. Next episode, we shall still continue to dwell on health as well as some of the other areas. It's been a total pleasure having you with us. See you next time. Thank you.